Hi! So today we will be talking about the 1718 Gracey Curet. And so this is what it looks like. It is an area-specific curet, and there are many different kinds of Gracey curets for different areas and surfaces of the mouth. There is the 1-2 for anterior teeth. Then there is the 11-12 and 15-16 for the mesial surfaces of posterior teeth. Lastly, there is the 13-14 and 17-18 for the distal surfaces of all posterior teeth. But today we are going to focus on the 17-18. So this instrument is designed to work on the distal surfaces of all posterior teeth. This is such a great instrument to use on those hard to reach areas of the mouth, mainly due to its complex shank, as you can see. So the complexity allows you to access difficult areas with ease. The face of the curet tilts at about a 70-degree angle to the lower shank, so one cutting edge is lower than the other. Therefore, there's only one cutting edge per working end. It also has a rounded back and a rounded toe and a semicircular cross-section. So the ultimate goal of periodontal instrumentation is the complete removal of calculus deposits and bacteria that are contaminating the tooth surface. Removing this debris can help bring the tooth and surrounding tissues back to health. This instrument, along with the other Graceys, are ideal to use on patients with deeper periodontal pockets. It's also great for wisdom teeth since, depending on the patient, it can seem nearly impossible to see the distal portion of the tooth. So with the 1718, you can really rely on your tactile touch to scale that area. It also has a thicker shank, which is ideal for removal of heavy calculus. Now I will be demonstrating on how to use the 1718 Curet. So to make sure you are using the correct working end, place the toe of the instrument in between the teeth, like this. Okay? So if the instrument is not parallel and is going down and around the tooth, then you know that that is not the correct working end. So if I go like this, toe is in between the tooth, but it's going down and around, that's not right. Using the instrument like this will not be effective and could potentially damage or injure the tissue. You want to make sure the terminal shank is parallel to the long axis of the tooth. So like this, there, parallel. Okay, so you want the face tilting towards the tooth and not away from the tooth. Also, over-angulation or under-angulation can result in incomplete calculus removal. So again, first make sure you have the correct working end, and we do. We're going to start at the distal buccal portion of the tooth, which is called the get ready zone. So then you want to insert the instrument below the gingival margin and make sure you have a nice strong fulcrum a few teeth away. And you want to insert the instrument below the gingival margin, open, and activate. Insert, open, activate. Okay, so it is important to use firm lateral pressure and make a series of short, continuous, overlapping strokes in order to cover every area of the tooth. You want to make sure you're using your wrist and not your fingers to activate the instrument. So you want to go like this and not like this, kind of like you're turning a doorknob. So insert, open, activate, like that. Okay, so one small disadvantage of this instrument is that there's only one cutting edge. So that means you have to frequently change instruments while you're cleaning or scaling or doing a deep cleaning. And also adaptation and angulation of area-specific curets must be correct. Otherwise, use of that instrument will be ineffective if you don't have the correct working end. And you wouldn't normally use this on a child just because they tend to not have any deep pockets, and it's just not necessary. So yeah, that's the 1718 Curet, and thanks for watching. Bye.